Quick Dentistry, celebrating World Environment Day, 5th June. We as medical professionals, healthcare workers, and dental practitioners have responsibility towards the environment. So medical professionals कैसे इन्फेक्शन को स्प्रेड होने से कंट्रोल कर सकते हैं? पहला इज स्टे हेल्दी बाय इम्यूनाइजेशन, पोस्ट एक्सपोजर मैनेजमेंट, मेडिकल फॉलोअप एंड रूटीन हैंड हाइजीन. Second thing is blood or body fluids से we should avoid contact by wearing PPE, limit spread of contamination by covering surface, disinfecting surfaces. This make the dental instrument safe for use, that is by cleaning and heat sterilization. ये ट्रांसमिशन होता कैसे है? फर्स्ट इज बाय कॉन्टैक्ट, दैट इज डायरेक्ट ह्यूमन ह्यूमन टच कॉन्टैक्ट विद माइक्रो ऑर्गेनिजम्स, और इनडायरेक्ट दैट इज ह्यूमन ऑब्जेक्ट कॉन्टैक्ट. नेक्स्ट इज ड्रॉपलेट इन्फेक्शन, splatter of blood, saliva, nasal secretion airborne by aerosols of microbes. Through direct inhalation when person coughs or sneezes, or indirect inhalation of particles less than 5 microns. Ingestion of droplets of saliva from instruments are swallowed. Auto-inoculation or percutaneous injury, operator touching his mucous membrane with contaminated patient items. इस साइकिल में हम देख सकते हैं कि कैसे इन्फेक्शन ऑपरेटर, फैमिली, ऑफिस, लैब स्टाफ्स, पेशेंट्स, मतलब पूरे इन्वायरमेंट में ये कैसे स्प्रेड होता है. What are the standard precaution? We have to break the chain of infection, that is from patient to patient, patient to dental personnel to patient. What is components of infection control? First of all, immunization of hepatitis B, rubella, measles, mumps, influenza, poliomyelitis and tetanus. Patient screening. Thirdly, hand hygiene with 2 to 4% chlorhexidine, 0.3 to 1% triclosan, 0.6% parachloromethazolino, and 60 to 70% propranolol. Components of good hand washing: cleaning nails and skin thoroughly, rinsing and drying thoroughly. When should we clean our hands? When hand is soiled, after touching instruments, before after treating each patient, before donning gloves, immediately after removing gloves. Now the barrier technique: personal protective equipment, gloves, surgical mask, protective eyewear, face shield, protective clothing, shoes and head covers. Please don't in following order: clothing, mask, glasses, wash hands, place gloves. Removal of PPE: gloves, mask, glasses, wash hands. Intraoral barrier technique: rubber dam, mouth rinse, 0.12% chlorhexidine gluconate solution for 30 seconds. Needles and sharp instruments should be positioned away from doctors and workers. Stop procedure immediately. Inform patient. Remove gloves. Injuries to the skin and mucous membrane should be washed well with water. First aid. Clinical support staff should ask patient to submit blood sample. Instrument sterilization, disinfection. Determine what should be sterilized, disinfected, discarded. Dental instruments are classified depending on risk of transmitting infection: critical, semi-critical and non-critical. Critical come surgical instruments that penetrate soft tissue or bone, semi-critical that do not penetrate soft tissue or bone, non-critical that only contact skin. Preparation of instrument for sterilization: immerse in the sink, manual scrubbing with detergent next to the autoclave, dry heat or chemical vapor. Proper asepsis of dental laboratory, clinic, radiographic area should be done. मैनेजमेंट ऑफ बायोमेडिकल वेस्ट: डिफरेंट कलर कोडिंग ऑफ डस्टबिन, जिसमें कि हम बायोमेडिकल वेस्ट को कैसे डिस्पोज करते हैं. येलो डस्टबिन, इसमें हम एनिमल वेस्ट, एक्सट्रैक्टेड टीथ, एक्सपायर्ड मेडिसिन, ये सब डिस्पोज करते हैं. रेड डस्टबिन में कंटामिनेटेड प्लास्टिक वेस्ट. ब्लू डस्टबिन broken glass waste. And white dustbin, इसमें हम जितने भी sharp instruments है that is infected, we dispose that. Thanks for watching.